So I'm currently a remedial massage therapist and Qigong practitioner.
I teach classical Pilates, I teach neuro movement, I teach lymphatic work, I teach vagus nerve work, kettlebell work, all different kinds of work to help people move better in their life and live fully.
Well, I've been doing MSTR for a number of years. Prior to that, I was and still am a Bowen practitioner, a yoga therapist, and I practice Thai massage.
My background has been dance and Pilates.
My background is in movement, so undergraduate, graduate studies all in physical education, recreational movement types of things. And I've worked over the years in hospitals, in school settings, in private settings, corporate settings, all dealing with health and fitness and those types of things.
I'm a naturopathic practitioner. I use nutrition, homeopathic remedies, a lot.
I'm an Ayurveda practitioner. So as far as bodywork treatment, there's a lot of massage, more massage than a lot of other body work, not specific body work, but in Ayurvedic massage, we're looking to soothe the tissues, soothe the nervous system.
Oh, look, probably like a lot of people, it was a personal session that got me interested. I had my appendix out when I was 6 years old. It was after I'd qualified as a massage therapist and becoming a little bit more sensitive and a little bit more aware about how the body works and how things are connected. And so I sought somebody out to try and see whether or not something could be done about my scar. And of course, I was blown away.
I actually was not expecting a whole lot, to be honest, and I was quite blown away by MSTR and the results that I saw, and quickly knew that I was in love with the technique, because in movement and even in other modalities that I've experienced personally, you can't get that kind of fast response that you can with MSTR. That's virtually painless.
Initially, it was from an experience in a dissection lab where I had the opportunity to view some internal adhesions, and they were quite severe. And I wondered if there might be some way to help those individuals before the adhesions got to be so severe. And it was not that long after that I found MSTR.
I found out when I heard about MSTR. I didn't know about this at all before. Nothing had ever come into my understanding of this method. When I heard about it, I became very interested and very curious.
Well, there was a sort of a rumbling going on in the science community and in the physical therapy community as a whole, that there was a big gap in how we were approaching our therapeutic outcomes. And one of those large gaps that was becoming very clear, and that was because you were coming forward so much, about scar work, that we hadn't actually addressed the scars in all of our therapeutic hands-on approaches or rehab, which seemed mighty peculiar. So that piqued our interest, and we started to turn our attention directly towards what MSTR was achieving and attempting to achieve through research and outcomes.
People would come into my studio with various issues. One in particular had over 20 scars on her body. And I tried to get, using all the tools I had, and I was making tiny, tiny progress, but not enough to really sustainable, nothing that was going to come through. And, so I did what any normal practitioner would do, and I got on Google and looked and located McLaughlin's scar tissue release. And through there, it's such an incredible technique that actually held. And my client with the 20 scars made remarkable progress. So much so that her surgeon was gobsmacked, basically, and said, "What did you do?" She said, "Oh, she's working on my scars."
That was accidental. I saw the beautiful Laura Murray, who was a previous instructor in Western Australia for a Bowen treatment. And she was having some difficulty getting my left shoulder to respond. She noticed the scar on my arm and asked permission, of course, to treat the scar. Next thing I knew, I was having this big emotional response. The shoulder responded, laid flat on the table, so I was blown away by the treatment.
And that is what has just been so amazing about the technique, is how easily it fits into what we do as massage therapists. I can use it at the start of a session, in the middle of a session, at the end of a session. It's so versatile, it's fantastic. Yeah, clients come in just wanting scar treatment.
My favorite type of client session is where I integrate, where I do some MSTR and where I do some movement, teach them some neuro, some MSTR, some lymph, some MSTR. I integrate everything together because it's so powerful, and everybody has a scar or adhesion, whether they realize it or not.
As a yoga therapist, I'm looking at how my people are moving, where their restrictions are, and implementing that hands-on piece works quite well. Yeah, the whole process of a yoga therapy is to do no harm, and MSTR is all about not doing harm.
So I've seen postures change within minutes of doing MSTR on them. I do work in separate times with it, and then sometimes I integrate it either before or after my session. So if I find that I need to work in an area on the body, I will do that before. And if I do the opposite and I start the lesson, then I will make sure that I do something at the end of the lesson so I don't stop the flow of what we're doing.
What has changed is that nowadays, or since I learned it, I always ask about scars, as I know that they can affect the body in so many different ways. Because if the scar is the cause of the problem, say that somebody has digestive problems and the scar is the cause of it, it doesn't really help to give them enzymes or different kind of diet or so on. You need to address the scar first, I feel.
Totally invaluable, Alistair. It's because we're dealing with so many, a whole range of injuries. It can be anything from actual surgical intervention for cruciate ligaments or supraspinatus tears, hamstring tears, groin problems, abdominal surgery, ankle sprains. The list just goes on and on, gastro problems, etc. So we get in there with the scar work, we are really changing the way that the person is rehabbing, and they're rehabbing about 40% faster than we'd normally see. Now, in professional athletes, that is crucial, because that person needs to get out on the pitch or the court or the whatever it is, Olympic event, whatever we're involved in.
It has changed everything, how I view bodies, how I view movement, and allows me to open up that area a whole lot more. So when I first started out, it was, how can I introduce this to new clients? So it was like a mix and mash of Pilates plus scar work, but that's just changed over the series of time. So now they'll come in only for scar work, or if they come in for like an NKT session, if they come in for a assisted stretching session, and I see scars, well, during part of my intake, I always dive into that, and once I see it, I just connect the dots at that point.
A guy named Timmy, and he was a Vietnam vet who had shrapnel in his cervical spine, and he had been restricted with zero range of motion, and he really always wanted the work to be very deep and very hard. And on one day I said, Timmy, I've got to try it this way, and it's going to be really light, very gentle. Well, let's just see what happens. And so I did a few passes of MSTR, and his very straight neck just suddenly spiraled, and he went, whoa, that's never happened before.
And it was this young woman. She had been out riding, and she fell off the horse, and she got dragged 300 meters across really sharp stones. So she got about 4 or 5 really deep scars. at her lower back. And when she came to me, she could not touch the scar because it was really, really painful. I could hardly touch it either. And she cried, you know, when she talked about it. She didn't want anybody to see it. She would not wear a bikini. She was in pain every morning getting out of bed. She couldn't make sit-ups. Well, she had a lot of pain. And after 3 treatments already, especially after 4 treatments, all that was gone. And she didn't cry. It didn't hurt. She could do sit-ups. All problems were gone.
I was working on a woman's hip, and she's like, "Oh my gosh, I feel my jaw releasing. How is that happening?" So again, it becomes an education piece at that point, just to say, this is how we're all connected. And the body is not isolated in one body part versus another. It talks to each other. Scars will talk to each other. And they're like, why am I feeling that over here? And it's like, so I get a chance to educate them on the fascial system and all that kind of good stuff. So yeah, the more they are in their bodies, or the more I can educate them to understand how their bodies are working, it's kind of a nice conversation.
It was an ACL, anterior cruciate ligament recovery, and Maxine was struggling to get back into full professional care. And when we did the scar work, there was almost like an epiphany, a light bulb moment, where the way that she mentally perceived the problem, and she went and started playing the game almost immediately at that match, and the block and the obstacle, and the restriction and the connection neurologically to that just disappeared.
Quite early on in my practice using MSTR, wonderful woman. She came to me because she had a gallbladder removed many years ago. I think it would have been, close to 40 years, 35 to 40 years ago. She had a niggling back pain, and we treated her scar. The most profound change that came out of those treatment sessions was her emotional healing and the forgiveness that was released or found for the surgeon, because it was an unnecessary surgery, as it turned out. So the forgiveness for the surgeon and the forgiveness for her partner. Her husband had died around the same time. So we're profound emotional healing that happened for her.
100%, it's changed everything that I do with my movement clients, especially when I have a pro cyclist who needs to get back out on the roads quickly, and they're trying to get the competitive edge. MSTR works so quickly when they've had these crazy surgeries or crazy crashes, be it head or abdominal surgeries or artery vein surgeries. They really, really get back out on the road and competitive again quickly.
Sometimes what is quite profound and beautiful is an old memory, like mine, but it doesn't necessarily have to be an old, a painful memory. But when we do have those tough emotional connections, they just dissolve. There's no need for the teasing out of the story or any counselling or anything like that. Just releasing the scar releases that memory from the tissues, which reminds me what Ayurveda says. The tissue, the connective tissue, the muscle tissue, we call it mamsa, which means memory. So we're made to hold that memory within us. So of course every scar is going to have the potential to have a memory. It's quite profound when it does happen.
So many people have no idea. They have no idea. And when I draw attention to it, maybe it's a muscle pattern that's not holding. And through MSTR, they see, they have reconnection to their abdominals, or they have a reconnection to their shoulder movement, and the look on their face is, priceless.
And it's a softness about it that I really like. And in sport, sometimes we lose a lot of that softness. It's got an edge. Yeah. And I like that softness, so I integrate the softness into the team as well. And that balances things. And being part of the MSTR team has been a privilege. Yeah.
I think the biggest difference for me has been the lightness of touch, and learning that sometimes less is more, and how easily and how much better the body responds to a lighter touch. As massage therapists, we're always go harder, go firmer, elbows. But in fact, when you pull back, you get better outcomes.
The fact that the blood circulation is not good, it's not optimal, the lymph drainage is not optimal. I mean, all modalities rely on the flow of these bodily liquids, right? So with the treatment that I'm providing and the clients are taking and applying MSTR to help them clear that, it's a perfect marriage.
So there is very little invasiveness and there is very minimum time needed. So I found this to be an extremely helpful tool to be able to have when working with people. And I've been working with people for 33 years.
What MSTR will do very, very effectively is bring the person back together. I often feel like I am gathering the person's parts, bringing them back together, a wholeness, a centeredness. And if we go even finer than that, with MSTR we enable the scars to integrate into the surrounding tissue. So everything's working together in harmony, cohesion. Yeah, it's really cool.
It's life-changing for you as a therapist. It changes the way you understand the body. It changes the way you work with the body. It changes the way you get results when you're working with your clients. And perhaps more importantly is it's life-changing for your clients.
Everybody, any therapist should really take this class, I reckon.
It is life-changing. It is life-changing for you because you can practice on yourself. It is life-changing for your clients because it's so simple and so effective. It sounds almost too good to be true because it really is. It's so simple. It's such a gentle, non-invasive technique that gets response so fast.
MSTR for me has made the more complicated things easier to solve.
You know, if you're traditionally trained, a lot of us sports scientists and physiotherapists, physical therapists are, you know, we're trained by almost down like a funnel. And then we forget to look and be curious outside of the box. So I would appeal, you know, to all physical therapists, physios and sports scientists to attend a one-day course, to actually see things from a completely different perspective and with an open heart.
What you learn in that time, it works immediately. It works immediately. We have seen transformations during class that people are just like, what happened? And it's like, well, it's the work.
Don't hesitate. Just Nike it. Just do it. Thank you. And thank you for this opportunity. It really has changed my life as well.